studies show that 1 in 5 people suffer from some form of sleep disorder today. But a fact that's even more staggering is that up to 80% of patients go undiagnosed. Dentists continue to struggle with how to onboard and integrate sleep into their practices today. So today on Schein Chats, we're going to talk about the importance of sleep medicine within dentistry and how dentists can more successfully integrate sleep into their practices. Greetings, I'm John Cox, here at Schein Chats, Vice President of Technology for Schein Dental. Today we're going to be talking to Dr. Joe Magness, the CEO of Devdent, the company focusing on developing dentistry, in particular the area of sleep dentistry. Dr. Magness, maybe to start off and give the viewers a taste, maybe an overview of what the importance of sleep dentistry or the sleep medicine within dentistry, if you could.
Okay, yeah, first of all, thank you. Good to be with you. So sleep medicine is very important. It has to be important because sleep is the foundation of health. And so the body, needs this time of the day for the brain to be able to process properly. It needs the brain needs time to consolidate memory. The body needs time to regulate hormones. The body needs time to boost the immune system, boost energy. And the cardiovascular system actually needs a break. So very important time.
So it is obviously safe to say that good sleep can translate to good health.
Absolutely.
And at Schein, we're all about delivering good health to patients, and sleep is, you could argue that it's been epidemic levels almost in recent years. And I've got to confess, I am a undiagnosed sleep disorder person. Okay. I went many years and I'd wake up so tired and not knowing why, until a good friend of mine who's a dentist said, John, you got to get a sleep test. My wife would remind me every evening. I'd wake up gasping for air. And since then, I've been on treatment. I've got a CPAP, and I'm going to be getting a new appliance, I know, soon.
You betcha.
But I wake up well rested, and my health is dramatically improved. So I am a walking example of a sleep disorder patient that seek treatment 20 years too late, and I can see the benefits. So I live and breathe it every day, Joe.
Yeah, no, absolutely. I'm the same. I have a statement, sleep changes everything.
So let's talk about dentists are struggling on how do they incorporate it into the practice. Maybe we can touch on the education piece. Where does a dentist start today? Where do they go, and what's the journey for them to successfully become confident that they can deliver the solutions to their patients, diagnose right, and then where do they seek the education?
Yeah, this journey, it absolutely starts with education. That's one of the things that my company has been all about. There's lots of educators out there. We want the dental profession to go out and get educated, figure out what's best for them, and absolutely start with education. And that's where it has to start. Find out from there yourself.
And let's talk a little about the education journey. Is it an ongoing program? Is it a go-to destination? Do they do some remotely? Maybe share a little bit with the viewers how they what this looks like.
It's all the above. Absolutely. We have courses that are all over the country. There's online. There's lots of educators out there that can teach. We live in the information age, right? So this information, people expect to be able to get information. It's out there if they'll look for it. Very important.
Now, technology has been changing dentistry and helping deliver dentistry in faster times, more convenient for patients. And maybe we can touch, has technology had a significant impact in the area of sleep medicine? Can you share a little bit what's going on there?
Yes, absolutely. So when I started doing dental sleep medicine 12 years ago, we didn't have the technology. I couldn't do the things I can do today. I couldn't make it as easy, as efficient, predictable. So nowadays, when we have all these home sleep test options, right? We have software that can help us in the process. We have 3D printing, from the actual treatment. Technology is there, and absolutely, this is the time to get involved. I always talk to people about Uber. Imagine Uber without digital payments or without GPS technology, without smartphones. Wouldn't have happened. That's kind of how sleep medicine has been in the past.
Okay.
It's not that way anymore. We've checked all these boxes. We have all those abilities, so this can be adopted and should be adopted by dentistry.
So what are the areas, obviously dentists play an important role in sleep medicine, and I think a growing role of importance. I can tell you from my situation, I was referred probably maybe 10 years ago to go to a sleep clinic and schedule, get busy, I don't really need it, and it's easy to put it off. Until recent, I don't know how recent, but until recently, I did a home sleep test. So my dentist administered a home sleep test. It was easy to do, it was in my own bed, I was more comfortable. Did it 2 nights in a row, sent the test, the test came back, and then they prescribed, obviously I went to a sleep medicine pulmonologist, somebody, and prescribed in my case it was CPAP, but it was very patient comfortable. It was easy, it was very accessible, and I would suggest that's one example of technology enabling convenience for patients. And if it's not convenient, patients typically aren't doing it.
Yeah, and even offices. If it's not convenient, if it messes up that normal workflow of a dental office, that can throw a wrench in the plans as well.
So let's talk about sleep appliances versus forced air. Can you touch on that subject? Because I know that's an interesting one for a lot of dentists.
Yeah, absolutely. So appliances, the appliances can do stuff that a CPAP can't do, right? And a CPAP can do stuff the appliances can't do. But the appliances, one of the biggest passions of mine in getting dentistry involved is to be more preventative, right? To catch this progressive condition, progressive disease, at an earlier stage. So when we're talking about snoring, we're talking about upper airway resistance syndrome, more mild obstructive sleep apnea earlier in the game, that's where oral appliances need to come in. That's where dentistry needs to screen. That's where dentistry needs to get involved and treat and prevent these conditions from getting worse.
So earlier identification of the issue, get after it earlier, provide some relief. It's all good. It's all good for the patient. Let's talk a little bit about the profitability side. Dentists today are challenged on many fronts with the changes to insurance and what they get paid for the work they do. It's an opportunity. Sleep is absolutely an opportunity for dentists to take a look at. And maybe we can touch on 2 things. One is they're concerned about how they bill for it. Okay. And I know you've got some expertise in this area, and you've spent a lot of time developing some software around that. And then the second piece, what impact can it have on a practice from a business standpoint?
Yeah, so from a medical billing perspective, that's one of the obstacles that people struggle with. So yeah, from a software perspective, to have a software that can do the billing for you, that can walk you through the process of getting the coding into medical insurance. Dental offices are not experienced in billing medical insurance. So that was one important obstacle that we had to provide, that our software does. From a, what was the other part you asked me about?
Just on the business, so the impact it has. So, but before you leave the insurance one, what does it look like today? So if I've got a front office team member that's responsible for submitting the insurance billings, and insurance is complex as it is it a service that you're providing, or is it a software that they would deploy in their practice and it would help process maybe you can share a little bit on the clarity on that would be good.
Yeah, it's both. We wanted to provide flexibility in our system. Some offices want to take that on. They want to do the medical billing. Some offices are like, hands off, hey, I want you guys to do it. And maybe they transition either way, as they start to do it. So yeah, the process, what it looks like with software is we're going to cross code. We're going to do it. So it's absolutely a software that they can use, but it's also a software that they can use and my company can use to actually process the billing, be the service. And I think one of the ways that the industry has responded to so well is we're only going to be successful if the office gets paid.
Sure.
And so we will only bill for successful claims.
So I'm a happy patient. I'm thrilled with the treatment I got. I probably would have paid more than I did for it. It truly has an impact on your health. Let's talk about the business impact. What's it mean for an average practice if they add 10 sleep patients? And knowing it's 1 in 5, 10 should be
very
it could
attainable.
be 10 a month.
Exactly.
So
yeah, and
let's talk about what it means financially to a practice.
Yeah, and I'd say like 10 a day, 10 a week, but a modest practice, being modestly successful in dental sleep medicine should be able to do 5, 10 appliances a month. Nationwide, the average reimbursement is somewhere in the $2,000 and $2,200, somewhere around there. So from a profitability,
for an appliance,
for the treatment.
Okay.
So as far as profitability goes, you're really changing the bottom line, and the way I like to say it, is we're going to improve patient care, and we're going to strengthen dental practices. And they both are kind of a cycle, right? If you improve patient care, you're going to improve the financial part of the practice. If you strengthen that practice financially, you're going to absolutely improve the patient care. Doctors will make better decisions. So to change the bottom line, to do some appliances a month, even 5 a month, you're talking, $10,000 a month of profit, and that can really change that practice.
Yeah, it's material.
Exactly.
And dentists are looking for things to do in the practice with their existing patient population.
Absolutely.
I think the exciting thing is knowing that there's 1 in 5 of the population today suffer from some form of sleep obstruction. And I don't know what the percentage is, you may know, but of that, would you suggest that there's a percentage that may get relief from an oral appliance? So what we're talking about here?
Yeah, so I do know the statistics that are out there. I say they're so conservative that I don't really pay attention to them much. So I will say 2/3. 2/3 of America struggles with poor sleep. And I hear stats of like 25%. I've seen up to 25% will have obstructive sleep apnea. It's so much higher than that. We have courses all over the country. We've had them for years. We sleep test every attendee of our course, and they get tested that night. They come back the next morning. We download the information. Over 90% of those people attending our courses have the numbers worthy of obstructive sleep apnea.
So not only is 1 in 5, but 90% of dentists.
90% of dentists and staff.
That's right. And so our viewer audience today is probably a lot of dentists, so we're going to say,
yeah, we better get them
pay
treated.
attention, we better get them treated.
Exactly.
Yeah. What's the first step? I'm a dentist. They may be listening to our chat today. What's the first step? What's that first thing they need to do to put the foot forward and say, I'm going to make a commitment to my patients, to help patients that are suffering that may not know what the answer is today?
This is absolutely education, bar none. Unfortunately, we don't have enough education in dental school regarding sleep. So this education has to come, postgraduate level. The opportunity, the possibilities are our courses. Like I said, these are in Schein centers all over the country. We really have a low cost, 2-day course. If you'll pre-register, it's a $500 registration fee. We have sponsors like Henry Schein, Plan Mecca, really driving down those costs. So it is a place to start and go see what this is about. The ADA's made their statement on what they should do and what they recommended that dentists do. And so, the dentist needs to go get educated. They need to go see, how does this work in my practice? Do I want to just screen and refer to the right patient? Do I want to screen and treat? So we have some flexibility, and all those decisions should be made at a low-cost education course, in my opinion.
That's fabulous, and I think the message to our viewers is indeed that it's the patient population needs it. There's nothing more gratifying than something like this where you take a patient and change their life. It's an exciting part of dentistry. Dr. Magness, thanks for joining us today on Schein Chats. I know the viewers are going to appreciate this information. Thank you to the viewers for joining us on Schein Chats today. Until next time, this is John Koch signing off. Henry Schein, Dental Schein Chats.